Symptoms and investigation of urinary tract disease. Symptoms: pain, الكدني ureter bladder posterior urethra anterior urethra. الكاركتر والسايت والراديشن. الكدني dull aching bit dull aching stretch of the renal capsule. اليوريتر coliking. البلادر dull aching. البوستيريور urethra dull aching. الانتيريور urethra burning. السايت الكدني renal angle. اليوريتر along the course of ureter. البلادر suprapubic. البوستيريور urethra perineum. الانتيريور urethra local pineal. الراديشن anterior renal point upper outer quadrant of the abdomen. اليوريتر along the genitofemoral nerve to the testis or labia majora inner aspect of the thigh. البلادر at tip of the penis. البوستيريور urethra at tip of the penis. الانتيريور urethra no reference. الهيماتوريا. Definition is passage of blood in the urine. Types varies according to amount of the blood, the pH of the urine. Large amount urine is red, might contain clot. Small amount microscopic hematuria. Small amount acidic urine, smoky urine. It should be differentiated from red colored urine due to hemoglobinuria, intact of beetroot, jaundice, smoky urine, drug as rifampicin or fluoridine. Hematuria can be classified into total hematuria from the kidney or massive bladder bleeding, terminal hematuria, passage of the blood at the end of the micturition. It indicates pathology in the trigon, bladder, neck, or posterior urethra. Initial hematuria, passage of the blood at the beginning of the micturition, indicate anterior urethral organ. Causes: general cause hemorrhagic blood disease and uremia, vitamin C وK deficiency, hypertension and anticoagulant therapy. Local cause: most common disease of the urinary tract cause hematuria, congenital, traumatic, inflammatory, neoplastic. The most common cause of hematuria: trauma to the urinary bladder, calculi of the urinary tract, tumor, hypernephroma or cancer bladder, infection, bilharzia, glomerulonephritis. Diagnosis: history: we have to find source of the blood, total, terminal, initial. Associated symptom: pain, difficulty, frequency, retention of urine, continence or intermittent hematuria, associated swelling, any apparent cause, trauma, drug, post-operative history of bilharzia. General examination: manifestation of hypothermia of the massive hematuria from UTI trauma, present of pleural anemia from chronic blood loss, sign of uremia, metastasis if due to malignancy, present of renal hypertension, constitutional manifestation of infection. Local examination: abdominal, unilateral or bilateral renal swelling, malignancy, obstructive uropathy, tenderness in renal angle, infection or inflammation, distant bladder, retention of urine. Heart, suprapubic mass, cancer bladder. External genitalia, blood at the tip of the penis, rupture urethra, discharge from urethra, urethritis. Secondary varicocele, hypernephroma. Rectal examination: benign prostatic hyperplasia, cancer prostate, cancer bladder. Investigation: laboratory, urinary analysis, bilharzia ova, malignant cell, RBC, pus cell, urinary cast, red cast, epithelial or haline cast. Kidney function: urea, creatinine clearance, blood picture, HB present, hematocrit, clotting abnormality. Radiological: plain X-ray, IVU, detect calculi, calcification, ascending cytostograph, bladder and prostatic lesion, abdominal sonar and CT with contrast, most diagnostic, cystoscopy, most useful investigation in case of hematuria. Treatment: anti-shock measurement if hypothermia, stop bleeding by vitamin K, disonine and cyclocapron IM injection. Treatment of underlying cause. Retention of urine. Inability to pass urine inspect of full bladder. Type acute painful retention of urine, chronic retention with overflow, acute on top of chronic retention, retention on top of the cancer bladder or prostatic lesion. Acute retention of urine. Cause obstructive urethra stricture or stone, rupture urethra, acute urethritis. Prostatic benign prostatic hyperplasia or cancer prostate, acute prostatic abscess, bladder neck obstruction, congenital or partial stone at the internal urethral meningitis, tumor or blood clot impact at the bladder neck. Post operative reflex retention, painful pelvic procedure, anal surgery, gynecological operation, instrumentation like cystoscope, neurological cause spinal cord injury, hysteria, spinal cord disease, gynecological cause retroverted gravity, gravity uterus, large cervical fibroid, ovarian tumor impacted in the pelvic. Diagnosis. In the patient has not passed urine for some hour and is unable to do so. Median piriform swelling in the suprapubic area, which is painful, dull in the percussion. Pelvic sonar show full bladder and may show cause. Treatment. Acute retention. Constant treatment as reflex operative retention is treated first. Analgesic is administered. The patient is instructed to get out of the bed and warm bath is advised. Except if the patient with the organic obstruction and injection of the parasympathetic can be prescribed, advise patient to try micturition in the front of the running water. Catheterization, fully catheter, Nilton of soft catheter, if constrictive treatment fail. If urethral catheterization fail, percutaneous suprapubic catheter can be inserted, sonar guide under local anesthesia, suprapubic cysto catheter.